Hi, my name is Sammy, and today I'm going to teach you how to instruct a patient to use a meter dose inhaler. So you're going to go ahead and first pull the medication out of the storage. So we got that out of the storage, and you're going to want to check that against the order from the provider. So I have that here. Basically, it looks like the doctor ordered an albuterol sulfate, 7.7 gram per 200 meters. So it looks like those match up. So you're also going to want to check the expiration date, and then you're going to want to check the lot number and document those into the patient log. So after you've done that, you're going to go ahead and wash your hands. You're going to take the medication to the patient's room and then check the medication a second time. So once you've done that, you're going to want to also check the 6 patient rights and introduce yourself, identify the patient, and explain the procedure. So I checked the 6 patient rights, so I'm going to say, "Hi, my name's Sammy. I'm going to be your medical assistant today. Could I get your last name and date of birth?" Today, the provider wants me to teach you how to use a meter dose inhaler, so we're going to go ahead and do that. So the first thing you're going to do, once you've identified the patient and introduced yourself and explained, you're going to set up the inhaler. So you're going to assemble that. So once you have that assembled, you're going to ask the patient also if they have any allergies to albuterol at all, and you're going to want to check the medication a 3rd time. So after you've done that, you're going to explain the instructions to the patient. So the first thing you're going to do is go ahead and remove the cap and shake the inhaler well. When you're taking this, you want to make sure you're sitting up straight, your head is tilted backwards, and you fully exhale. And then you're going to place the MDI in front of your mouth about 1/2 to 2 inches, and you're going to want to create a seal around the mouthpiece. And then you're going to want to inhale slowly and deeply and exhale one more time. On that next exhale is when you're going to go ahead and push down the metal canister, and you're going to want to inhale for about 3 to 5 seconds. And once you've done that, you're going to hold that for about 10 seconds, and then you can go ahead and breathe out. And you're going to want to wait about 1 to 2 minutes until you do the next one, and then that is going to be based off the indication of the doctor's orders, how many times they want you to do that again. Since there is a steroid in this inhaler, you're going to want to go ahead and rinse your mouth out after each one, and then you're going to want to clean the mouthpiece with some warm water as well. But now I'm going to have you go ahead and demonstrate for me and show what I just taught you. So you're going to go ahead and have the patient demonstrate back to you what you just taught them, and after that, while they're doing that, you can wash your hands again. And you're going to want to put the cap back on the inhaler. And then you're going to give this inhaler to the patient. You're also going to give them a paper with instructions on how to perform that again, just in case if they have any questions or anything. And then you can go ahead and document that procedure.